Hi, I'm Patrick Dunnican. At Gibbons, we believe that citizens need to be informed about the complex issues that affect their lives. That's why we're proud to support the programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Credit Unions, banking you can trust. MD Advantage Insurance Company of New Jersey. PSE&G, committed to improving New Jersey's economy and strengthening its communities. The law firm of Gibbons, P.C. New Jersey Manufacturers. Activus, in cooperation with the American Medicine Chest Challenge. And by Cohn-Resnick, Accounting, Tax, and Advisory, where forward thinking creates results.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hold on, I'm fixing myself here. You got me on camera doing that. I'm Steve Adubato. More importantly, we want to introduce and welcome Mr. John Rutkowski, who is Program Director, Respiratory Therapy Program, County College of Morris. Good to see you, John.
Good to be here. Thank you.
You know, first of all, a lot of people don't even know what a respiratory therapist is. What is it?
Respiratory therapists are a relatively small group of professionals that work in hospitals compared to nurses, which everybody's aware of what a nurse is and what a physician is. So respiratory therapists are a specialist that help the patient deal with breathing problems. So we're always seeing patients who have chronic obstructive lung disease like emphysema or cystic fibrosis is another example. Treat asthma patients.
How'd you even get into this?
I actually, one of the first jobs that I had when I was actually going to engineering school was working in a small hospital in Jersey City, and the position that they held open was for a respiratory therapy. We called it inhalation therapy back in the, in the 60s. Yeah. So that kind of gives you an idea how the profession evolved. But, so I needed money. I took the job, and I had this wonderful mentor there who was, we were allowed to be on the job trained back then. And I learned a tremendous amount from this nurse that was kind of leading the department.
And you know, it's so interesting. You talk, John, about what you learned from someone else. But what interests me about you, as I was reading about your background, is that beyond the clinical side of things, beyond the technological advances in medicine, your obsession, tell me if I'm wrong, is coaching and teaching students about the importance of empathy, about connecting with their patients on a human personal level, about communicating with them on a human personal level, beyond all the technology. Fair assessment?
Yeah, absolutely.
Why are you so caught up in that?
Because when you're treating the patient in a way that helps you gain trust and develop a relationship, everything is much more simple. It goes faster, it goes quicker. The patients get better results. Patients get out of the hospital.
Give me, for instance, why can't a respiratory therapist or any other clinical professional come in and say, why can't you walk right to the technology first, do what you have to do with the patient, and if you have time, talk to the patient later? What's wrong with that?
It's just the wrong way to do things. In my mind, and I think in minds of many other people, you need to first thing you need to do when you get into the room is address the patient. And I tell my students, I don't even care if the patient looks like they're unaware of what's going on. You always go to them, address them, maybe hold their hand for a little while you're talking with them. Yeah, because they may be aware of what's going on and they just can't show it. So you need to make sure that the patient's aware of why you're there, who you are. And then you can take care of the technology. The technology these days kind of takes care of itself for the most part, unless there's a problem that has to be addressed. But if you ignore the patient, very often, even if they are comatose, when they wake up, they'll remember bad experiences.
It's so interesting. I think back to the whole concept of humanism in medicine, which our good friend Dr. Arnold Gold, who people know us in public broadcasting, he's been a giant in this industry for years, and he was friends with Patch Adams, the movie Patch Adams, where this whole concept of humanism in medicine was introduced. It wasn't called that. But is that a lot of what you're talking about?
Yeah, it is. And again, it's a lot about developing positive relationships with patients, making the experience better for them. You know, hospitals have always been concerned with patient satisfaction.
Right.
They do surveys. And you always get complaints and various things. And a lot of the people attribute it to bad food or something like that, or undesirable food. But some of the largest complaints are always about communications.
Not enough?
Not enough or ineffective. If you're speaking to, I can talk to a doctor one way. I can't speak with a patient that way. Just they won't understand what I'm talking about. And if you're doing that, you're talking to them, but you're not communicating with them.
I'm curious about something. You know that I'm fascinated by the field of communication.
Yes.
I study it, I think about it, I write about it, I struggle with it. But here's the question I've often really struggled with. Can you truly teach empathy, compassion, and caring? Or is it innate in someone?
In many people, it's innate. It happens. And they, maybe from their upbringing, they may have carried that through to them. But you can learn to control your own emotions and help to manage the emotions of the patient through what we call emotional intelligence training.
The Daniel Goleman philosophy of
Daniel
emotional
Goleman.
intelligence.
Well, the philosophy precedes Daniel Goleman. It goes back to as early as the 1930s when they started to talk about social intelligences. Dan Goleman was the one who popularized it.
He popularized
It's a fantastic book.
A must read.
Yeah, it's a must read.
But how does it relate? But it relates directly to medicine, clinical, and patient treatment.
Right. The two, it's a broad set of competencies, behavioral competencies that we can all learn to develop, and that's one of the things that makes it different in some people's minds from academic intelligence, where academic intelligence, some people think you can't really develop it past a certain point. But with social intelligence or emotional intelligence, you can keep learning things. And that's why I think sometimes you find that the older you get, the better you understand what's going on. So I'm always concerned about, and sometimes you see this where young people don't communicate well.
Well,
because they don't interact with people. They interact with
electronic devices haven't helped.
Right.
You know what's so interesting to me, John, is that you're also, bottom line is you are impacting future healthcare workers and others who are going to interact with patients, and the potential exists that they will be more empathetic, caring, and compassionate. That's a big deal. So John Rutkowski, Program Director, Respiratory Therapy Program at County College of Morris, I want to thank you for joining us and doing important work. We appreciate it.
Very good. Thank you.
Stay right there. Don't go anywhere.
Right.
I'm Steve Adubato. This is One on One. We'll be right back right after this. Thank you very much, John.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Daniel Czerniawski is Chief Operating Officer, Atlantic Federal Credit Union. Good to see you, Daniel.
Pleasure to meet you.
Let's talk credit score. Let's talk debt. Let's talk FICO score. What's FICO?
FICO is Fair Isaac Credit Company. They are a publicly traded entity, and they produce the most widely used credit score in the United States. You got to see it on fun commercials like freecreditscore.com, things of that nature. But they don't drive down to the true score and really what we use as financial institutions when we make evaluations on whether or not give a loan. The score itself is kind of the macro side of it. People like to see the score, but it doesn't drive down to what's your personal finances, what really drives that. So what we try to tell people first and foremost is you can go to a bunch of websites, but you want to go to FICO if you want to see the score that gets most widely used. And then you want to kind of understand what goes behind that score, what's driving at that score.
Okay, say you want to get your whole situation under control, which all of us do. Mm-hmm. What goes into your overall credit score? What kinds of things?
Okay. The most commonly heavily weighted items are debt burden. They like to
debt burden. What's the difference between debt and debt burden? Is that just jargon?
Debt burden is a nice way to say, how much can you afford to pay? I think that's a nice way to put it. A little bit earlier we were mentioning, I like to tell the story about my wife. My wife is
I know, actually, full disclosure, I do executive coaching in the other part of my life. Believe it or not, people pay me to give them professional advice. And your wife is one of my clients.
Yes.
For a great firm called Cohn Resnick.
Yes, and she came from another country and immigrating over from Poland, where it is not common to carry debt. The first thing she thought was, I will pay everything off, I will not keep a darn thing, and I will close it.
What did you say to that?
I told her after she closed the card, I said, you realize your score just went down and you made it harder for us to get a mortgage. So
Well, I would think, wait a minute, why does that happen?
So one of the weighted items happens to be how long you've had credit for. So if you are recently into the country or when your kids first start, there might be a thought, get rid of your credit cards. But the overall score also takes into account having different types of credit. So the weighting picks up a little bit towards how long have you had different types of cards and how well you use them. So, you know, they have a business not telling exactly of anything, but the three major bureaus that are out there have people report up, people like my credit union, that'll say you've paid your auto loan or your mortgage for a period of time. That goes into their weighting. And then there is a factor on credit cards or what we like to call open lines. So home equity lines of credit,
Right.
your open credit cards, how much of them are you using that? We then take a look at what we would call a bankruptcy indicator.
Whoa, 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 time out, hold on, go back. By the way, we're putting up websites so people can get more information. Your bankruptcy indicator.
Okay. So
What is that?
Well, if you like to think about this, if you were in a boat bailing water and the way down, the easiest thing to do is take on as much as possible. Exactly the same thing happens before most people declare bankruptcy. Their credit card debt immediately begins to accelerate. Every open line of credit they have, they probably use everything they have on that, and then they go to an attorney to declare bankruptcy. So it just, you know, it happens to happen, and we look for that.
Okay, so let's do the bankruptcy thing. The question is,
Okay.
because some of my friends have said, I quote, I think it's a good time to declare bankruptcy. And I always think to myself, what's a good time to declare bankruptcy? Is there, like, what does that mean?
Well, what I would tell everybody is what we spend a lot of time ourselves doing is trying to direct people to actually build out a plan. And that goes back to your credit score and anything else. Take a look at what you have there. We pay for a company called GreenPath, and GreenPath actually coaches people through their individual cards and building a budget, which would be hard to believe most people don't do.
Yeah, we'll talk about budgets in a second. Go ahead.
So we then work with this company to basically work with the individual creditors, and then if you can't, I mean, at some point you have to make a decision between eating and paying the bank. And even me as the bank would say, you probably should eat. You're not going to be paying my bill if you don't eat
That's
anyway.
right.
So that's kind of the workout, so to speak.
So now you declare bankruptcy.
Okay.
Describe the process.
The process out is you're going to want to reestablish credit. And simplest thing most people are going to go tell you to do is go down to your local credit union and open up a secured loan. Put aside something showing that you're paying a bill. So, auto loans would be the most common item.
Does the amount matter how much?
No, what most are probably looking for is the ability to pay a bill on time. You have a period of time up to 30 days before somebody hits a credit bureau. So if you're due on the 1st and you don't pay the bill to the 1st, you now have something that shows up as a delinquency. And then it rolls, we consider 30, 60, and 90 days. These are big numbers because it's likelihood of default.
Okay, I'm curious about something. I'm looking at this information that my producers provided me, and I think to myself, as you did the pre-interview, I thought, one of the things you talked about was why people get into debt. Why do most people who are smart, don't want to get into debt, why do most people get into the kind of debt that causes them huge problems?
I can embarrassingly say that even when I first met my wife and began dating, that we didn't build a budget.
Did not build a budget.
Nope, a banker.
Are you
and
saying
accountant.
that, hold on, go back Dan. Are you saying that when you and Magdalena got together, dating, in this romantic period, the subject of budgeting did not come up?
No, not at all. I think more embarrassingly, a banker and accountant got together, decided to go open up rental and purchase rental properties, still didn't have a budget.
This is great. A banker and an accountant get together, and that sounds like a joke, and they don't talk budget.
No, and they have kids, and that's really when it starts to kick in. But it's for everybody, and we go through this, and I can tell you the people that do the best work for me in dealing with people on budgets are my collectors, because now you're paying attention. Now they tell you.
Why is it so hard for us to put together a budget together, A, and B, what's the best advice to put it together?
Put it together is, what do we start with your after-tax income? What's my
after-tax income, go ahead.
Because for most people, it's your take-home income, and then start to really say, here's what I'm going to be spending on my living expense, my house, my whatever it is, my kids, my car, and here's my when things go wrong money. And if you don't put that in there, then you're going to be coming back to the bank. And what tends to happen, I've had people come say, I need to borrow money for rent, I need to borrow money for vacation. Well, now you've just increased what you have to carry each month and made it more harder for you to get out. I mean,
How about all these people who are convinced they need certain things
oh, they're
that they may
wonderful,
not
aren't they?
necessarily? What are you laughing at? They need these things. They need that very expensive car.
It's a
They
direct
need those
correlation.
shoes.
It's a direct correlation.
Help me on this, guys. I'm not going to ask the guys in the control room. I know a friend of mine, his wonderful wife, had to get, what are those shoes that cost like $1,000? The ones with the red bottoms?
You got
Louboutins.
Louboutins?
Well, don't act like you don't know what I'm talking about.
I have a little sister-in-law that just needed her, she's 16.
Right.
She just turned 17 and she wants her new car. But
She didn't get Louboutins.
No, but she wanted that Michael Kors purse.
What?
I don't even know what it was, but I know she wanted a $400 purse. And I told her, well, I'll tell you what. You can spend $400 on your purse, you can spend $400 on your car, but you're not doing both.
Not doing both.
No.
Okay, but go back to my Louboutin things. I'm obsessed with this. Because my friend came to me and he said, I'm going to get her Louboutins because it'll make her happy.
Mm-hmm.
And the guy, trust me, was talking to me about having a hard time paying the mortgage. And I said, so you're going to do the Louboutins. What do they cost? Tell me seriously, Google this. You knew that, $100? $700, $800.
Someone in your studio tried to buy them. That's what happened.
Oh, they're not buying them, but we pay them. So $700, $800, right? Just because they have the red bottoms, I guess they're pretty cool. I don't know. And the person having a hard time paying the mortgage. That's not good for your budget.
It's terrible for your budget, and the worst part is nobody will actually.
But his wife is happy.
Wife is happy till they come take the house. It's usually one or the other.
Steve Barcy on camera. What are you laughing at? So are you saying that the answer is no sometimes?
The answer is no most of the time. It's just
You're
reality.
no fun, you know.
I'm
You
the
are no
banker.
fun.
Nobody likes the banker.
But it's got to be done.
It's got to be done, and we were just doing college applications with my sister-in-law yesterday, and I told her she wants to apply to Princeton, to Yale, to Harvard,
Yes.
and I said, are you aware what they cost? And she said, well, what do you mean? Well, each one of these costs an application, and she wants to apply to 36 schools, and I said, that'd be very nice, except you're not going to go to 36 schools, you're going to go to one. I need you to bring it back in and realistically think. So I told her, I'll tell you what, we'll pay for you to apply for Princeton, to Harvard, to Yale. If you want to do all three, you're going to pick up the cost of the other two.
You know, do people in your family come to you with this stuff?
Yeah, unfortunately.
And then after they do, they go, why did we come to them?
You know, it's sad, but the reality is someone has to be the bad guy.
Someone has to be the smart guy, and you're the smart guy. Daniel Czerniawski, Chief Operating Officer, Atlantic Federal Credit Union. You are a smart guy, and you give us the answer that we may not want, but the one we need. Dan, I appreciate it. Great stuff.
Thank you very much, Steve.
Stay right there. Don't go anywhere. We'll talk finance off the air. Stay with us. We'll be right back one-on-one right after this. That was good.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
We welcome Dr. Thomas Birch, Chair of the Infection Prevention Committee at Holy Name Medical Center. Good to see you, Doctor.
Thank you. It's an honor to be here.
Well, let's talk about a few different areas. This virus, the Ebola virus?
Yes.
How serious in the fall of 2014 as we do this program, how serious is the situation?
This is getting more serious all the time, especially for West Africa with an epidemic that continues to grow somewhat exponentially, taking more lives and affecting larger areas, but really for the whole world because of the potential to spread.
How about the United States?
Well, there's a small chance that it could come here at this point. Travel is restricted and people are being screened, and most of the people who are affected are not of the class that they would be able to get on an airliner and fly.
What is it?
It is a viral infection that's very easily transmitted by body fluids. It causes an illness like many viral infections at the beginning with fever, weakness, headache, sore throat, muscle aches, nausea, vomiting, diarrhea. But then it progresses to cause hemorrhage and necrosis of internal organs and death in a high percentage of cases.
High percentage?
High percentage.
Hard to survive it?
It is. It's 60% mortality in this epidemic and up to 90% mortality in previous epidemics.
Difficult to treat?
Very difficult. There's very little
Resistant?
direct treatment right
Antibiotics?
now. Well, there have been no antibiotics. There's an experimental antibody which is available in short supply, which was slated for early phase trials, so there isn't a big supply. It's not easy to produce, and it has been used, and it appears to have good effect, but not enough people have been treated to really statistically determine how effective it is. But it's not an available therapy right now for most of the people who are affected because of the limited supply.
Before we move off this topic, is there any message you want to leave to the citizens in the tri-state area and East Coast watching us right now?
Well, medical centers throughout the United States, especially those that are in major entry areas, are taking precautions to identify people who would have a travel or an exposure history and to place them into prompt isolation, and that we're prepared to treat Ebola if it would come to the United States. But overall, the risk is very low as judged by the CDC and the World Health Organization.
Okay. Let's move to another topic. I don't think I've ever said this on the air, but I should be embarrassed to say this, right?
No, you don't have to be embarrassed
Okay.
to talk about this.
I don't think I ever talked to my producers about this either, but MRSA, which stands for?
Methicillin-Resistant Staphylococcus.
Which is a serious situation, can be serious.
It's a bacteria.
Yep.
Yes.
I have MRSA.
Yes.
And about 3 years ago, I got it and it came back again.
Mm-hmm.
And it changed my life in so many ways. What is it, and what do we need to know about it?
We all talk about staph and strep periodically in terms of skin infections, and staph is a common normal organism on the skin and in the nose, and it causes a large number of skin infections in general. When penicillin came into civilian use in the late 1940s, most of the staph was sensitive to penicillin. It became resistant, but researchers developed methicillin. Later, staph became resistant to methicillin, and that's where we get the term Methicillin-Resistant Staphylococcus.
Is that
or
why it was so
Staph
difficult?
aureus.
Excuse me for interrupting. I remember when it happened, it became very difficult to find anything to treat it.
Well, there are antibiotics that are available, and we have a few new ones even in the last 3 or 4 years that might not have been available when you were treated. We do have one prominent antibiotic named vancomycin.
Vancomycin, yeah.
Yes.
But I couldn't, there's some reasons why I couldn't take vancomycin because I was on some other medication. But here's the thing.
Mm-hmm.
I remember being treated with intravenous.
Yes.
Okay. And I tell you who the doctors were, I'm not going to go into, they had the best folks. But I had no idea what this was. And they came back again, and I started finding out that in hospital, people get it in hospitals and potentially in the community.
Yes.
What's the difference?
Well, the difference is that the community acquired tends to be sensitive to other antibiotics, but it has more virulence factors, which means it's more likely to invade and cause serious illness. Whereas the hospital strains don't have those virulence factors, but they tend to be resistant to other antibiotics. Either way, the organism can invade and affect almost any tissue in the body.
And it affects your immune system.
Well, it does, because you get so sick, and when you're sick, you can't eat, and you have inflammation, your body tissues are broken down a little bit by that inflammation, and so your immune system is depressed.
Let's talk about the fact that you're very concerned, and others in your field are very concerned about the abuse and overuse, if you will, of antibiotics. Talk about it.
That's a major problem right now, because in some cases we're down to last-line antibiotics to treat infections that we're seeing in the hospital today. And that's one of the reasons why I grouped the subject of Ebola with resistant organisms, because we take antibiotics for granted. We've been in the antibiotic era for about 70 years, and we have dozens and dozens of antibiotics, and they've really been a miracle in the treatment of infections as well as in supporting so many other medical technologies like transplant, immunosuppression, cancer chemotherapy, surgery, things like that all require antibiotics in case infections develop. If we come to the end of the antibiotic era, it will change all of medicine. And we have the potential for these epidemics, which come up periodically as we see. They often come into the news, whether it be MERS or SARS or West Nile or this enterovirus that's in the Midwest right now. We're hearing about them more and more frequently as we live in a denser populated world, and so we depend very much on our antibiotics, both the preservation of the ones we have and the development of new antibiotics.
So we should not be using them, quote, just in case. We should only use them when we have to.
Sometimes just in case is required, but overall it would be better if we could use less. And certainly with common colds, that's one thing that affects everyone in the community. Those viruses are not sensitive to antibiotics. Generally, they're not caused by bacteria, and we should not look to doctors to prescribe antibiotics for the common cold. That's one major area. The other is agricultural use. Probably 70% of the gross weight of antibiotics used in the United States are used for growth promotion and not for treatment of specific illnesses in cattle and chicken and sheep.
So antibiotics in our meat?
That's right, exactly. Because they're growth promoters, and these animals are kept in very tight confinement. There are high rates of infections that can spread through those areas. But in addition, the animals grow faster if you give antibiotics, even in the absence of disease. There's some debate as to what the cause of this is, but it is a proven fact, and it's been a major economic issue, and the regulation has been slow to come because of the influence of that industry.
Dr. Thomas Birch, important information about infectious disease and particularly how we're using and abusing, in some cases, antibiotics. Thank you so much.
Thank you for having me.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Credit Unions, MD Advantage Insurance Company of New Jersey, PSE&G, the law firm of Gibbons, P.C., New Jersey Manufacturers, Activus, in cooperation with the American Medicine Chest Challenge, and by Cone Resnick. Promotional support provided by the Star Ledger, powering NJ.com, and by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
My daughter passed away 9 years ago, and I had to quit my job to raise my twin grandsons who have special needs. I needed a car to get them to doctor's appointments, but my credit was bad and I couldn't get approved for a loan. So I turned to the credit union and everything changed. They showed me how to fix the problems I had and helped me get approved for the loan I needed. Since then, my credit got better and I could take care of my grandsons. I don't know where I would be without the credit union.